Hi there, I'm Ainsley MacLean from the Mid-Atlantic Permanente Medical Group, Regional Medical Director for Imaging Services for the close to 800,000 patients of Kaiser Permanente Mid-Atlantic states that we serve in this region. And I'm going to be speaking with you today briefly on a great best practice that we've implemented in our large integrated healthcare delivery system and what it has done to allow us to maintain expeditious times to ultrasound-guided breast biopsy while pretesting for COVID-19. Now, just a big thank you to many people who were involved in this great work, spanning from radiology to surgery to lab and pathology, as well as our infectious disease colleagues, and of course, all of our mammographers and breast radiologists who've done such an incredible job delivering safe, compassionate care to our breast imaging patients throughout the COVID-19 pandemic. I also want to thank Cedric Wilson, who's our Director of Imaging Services, with whom I work closely, and he oversees the close to 600 technologists, nurses, and staff of the Department of Imaging Services at Kaiser Permanente in Mid-Atlantic. Now, just to give you a brief overview of our volumes, we are performing close to 100,000 2D and 3D screening mammograms annually, 20,000 diagnostic mammograms, and about 2,400 breast biopsies and aspirations. In 2019, we performed greater than 30 to 45% of these biopsies the same day or next day following the diagnostic mammogram, and greater than 60 to 70% of these biopsies within 1 week of their diagnostic mammogram. So you can see that we place tremendous emphasis on delivering expeditious care and diagnosis to these women because we do know the second they have an abnormal diagnostic mammogram, the worries begin, and we want to ensure that if it's negative, they can go on and enjoy their life worry-free. If it is positive, we want to make sure that we can plug them into our multidisciplinary breast cancer care teams to make sure they get expeditious treatment. Now, with the advent of COVID-19, we did make the decision to pretest for all breast procedures. Why would we pretest at all? This is basically because we do feel that we should reschedule any elective breast procedure if a patient tests positive for COVID-19. And this is really for their own safety and that of other patients and providers. It also allows us to conserve PPE in certain instances. We take tremendous pride in the expeditiousness with which we read our screening mammograms as well, as an aside. And we have finalized over 85% of 43,000 screening mammograms year to date this year within less than 1 hour. And our patients do get those results via kp.org immediately, which is our patient portal. The reason I mention this is we like to keep up this fast pace for them. They get their screening mammogram results quickly. We like to plug them in for their diagnostic mammogram quickly, and therefore then provide their breast biopsy quickly. And so our concern was with the introduction of pretesting that we might put some delays into this end-to-end process. So basically, we did make the decision when we resumed routine screening mammography services in May, along with the rest of the country, we began requiring COVID-19 pretesting for all patients prior to breast biopsies. And we did feel, like I've said, that it was really important that despite this, we continue to expedite those times. So how do we do pretesting at KP Mid-Atlantic states? We have several drive-through testing sites at 5 of our larger centers, and as well as home testing kits, which are FDA approved. And our patients can either use this at home, we send them home with it after their diagnostic mammogram if they require a biopsy, or they can use these on site. Now, we're very fortunate at KP Mid-Atlantic states that we have very rapid turnaround time of our COVID testing. So for even routine pre-testing, 96% of these patients do receive their results via our patient portal, kp.org, within 24 hours of receipt of that specimen, with a mean of approximately 13 hours. So this has been tremendously beneficial in allowing us to continue our breast biopsy workflow. Now, I'm not going to belabor this, but just to let you know that our process is essentially that when the radiologist recommends the biopsy, we initially then encourage the patient to get a biopsy appointment within 7 days. And so that we don't leave them hanging, we don't leave this out in the air for them to schedule, and with the risk that they may not schedule at all. So we then escort a patient to one of our liaisons who help them to obtain an appointment and instructions for the COVID-19 testing, whether they choose to do it on site, at home, or through one of our drive-throughs, and then with the goal of having that happen within 24 to 48 hours of their biopsy. This is to just give you a brief look at what our on-site testing looks like. So this is using the home testing kit. This is performed by the patient. They do a very easy anterior nasal, so not a nasopharyngeal, an anterior nasal swab. And our technologists observe our patients doing this. It's very quick. It allows for significant conservation of PPE, and our patients are absolutely thrilled to leave from their diagnostic mammo appointment already with a COVID test having been performed, and then know that they have their biopsy set up, and we can proceed as quickly as possible with that. So what did we find? We actually found something really interesting. While of course, the percentage of our patients which had same day, next day biopsies did decline by definition because we have to introduce the slight delay of the COVID testing, we actually found that we had a similar proportion of patients who had their breast biopsy within 7 days of their diagnostic mammogram, and this was close to 60%. So we were really, really pleased with that result, and excited that there was not a huge change in that. Similarly, close to 99% of our patients had it within 14 days or 2 weeks. And while this isn't our goal to have that be our best case scenario, of course, it is important that all the women are captured, and that was similar to what we were seeing pre-COVID. So the biggest drop off was the same day, next day biopsy rate, as we did predict. But within 7 days, we were still hitting a very high number percentage of our patients, close to 60%. So our conclusion was that when results are available within about a day of specimen receipt, as within our organization, pretesting for COVID-19 prior to ultrasound-guided breast biopsy may be easily performed, either on-site, at home, or via drive-through, without delaying the time to biopsy significantly. So while we did see a drop in the same day, next day biopsies, as I mentioned, 60% of women still receive their ultrasound guided biopsies within 7 days, and close to 100% of patients within 14 days. So from our perspective, pre-testing for COVID-19 can be performed prior to breast biopsy without a concern of delays of expeditiousness to definitive breast cancer diagnosis and treatment. Thank you so much for your time and attention.